This is the last section of notes for Unit 2. After you review this presentation and then go back and look through your notes from Section 1 and Section 2, you should take the quiz that I posted in the Week 9 folder. Biomedical therapies. Physiological interventions intended to reduce symptoms associated with psychological disorders. Treatment with drugs: anti-anxiety, antipsychotic, antidepressant, and mood stabilizers. Anti-anxiety drugs are designed to reduce tension, apprehension, and nervousness. An example, Valium. Often called tranquilizers, they have an immediate effect and are fairly effective. Antipsychotic drugs are used to gradually reduce psychotic symptoms, including hyperactivity, mental confusion, hallucinations, and delusions. They reduce psychotic symptoms in about 70% of patients. They do have many side effects, including tremors, drowsiness, cottonmouth, constipation, and impaired coordination. Antidepressant drugs gradually elevate mood and help bring people out of a depression. Examples are Prozac, Paxil, Zoloft, MAO inhibitors. I will add this link to your class folder for this week, so please make sure that you view this video attached to this slide. Evaluating drug therapies. Drug therapies can produce therapeutic gains for many kinds of patients. Can be effective with severe disorders that otherwise defy therapeutic endeavors. Controversial. Critics of drug therapies. Some say that it is not as effective as advertised. They produce superficial, short-lived curative effects. For example, Valium does not solve problems with anxiety. It provides temporary relief from an unpleasant symptom. Relapse rates are substantial when drug regimens are discontinued. Many drugs are overprescribed and many patients overmedicate. Side effects are often worse than the illnesses that the drugs are supposed to cure. I'm thinking that you noticed a couple pauses during this slide. It's because Mr. Scare was talking really loud, and I was trying to determine whether or not I would restart the video for this slide or if I would continue. So obviously I continued, and hopefully you didn't hear Mr. Scare too much. There he goes again. And my door is closed. ECT therapy is somewhat controversial. It is a biomedical treatment in which electric shock is used to produce a cortical seizure accompanied by convulsions. Today, if this regimen is used, a light anesthesia is administered and the patient is given a variety of drugs to minimize complications, such as spinal fractures. Electric current is applied for about a second, and then a current triggers a brief convulsive seizure. Patients are usually exposed to 6 to 20 treatments, and this is not used very often. If you're looking to watch, a pretty good movie that shows ECT, it's pretty old. It's One Flew Over the Cuckoo's Nest. It may be on your senior reading list for Mrs. Tappan if you have her for English, and it is a really good book. It's a really good movie also if you are interested in learning more about the treatment using shock therapy. This therapy peaked in the 1940s and declined in the 70s. One Flew Over the Cuckoo's Nest, I think, was made maybe in the late 60s, so again, Jack Nicholson is the star, and it is pretty good if you're looking for something to rent or something to read for English. It has increased, though, however, in recent decades, mostly because of the advancements made into, the anesthesia and the humane treatment of patients. Critics will argue that It is overused, though, because it is a lucrative procedure that boosts a psychiatrist's income. So it can be very costly, and some will argue that the expense is not worth the medical gain. Is it effective? It can be remarkably effective for treatment for major depression. Cons, some say it is no more effective than a placebo. So you might want to look up what the word placebo means before you take your quiz. There is risk associated with it, and that is memory loss and also structural damage to the brain. Current trends and issues. Treating patients with mental disorders is grappled with constraints of managed healthcare. HMOs, who determine whether or not the care is deemed medically necessary. Institutional treatment. This includes mental hospitals. It's a medical institution specializing in providing inpatient care for psychological disorders. Looking at the trend of deinstitutionalization, which is transferring treatment of mental illness from inpatient institutions, which can be costly and cause havoc on your family, to community-based facilities that emphasize outpatient care. This is due to the emergence of effective drug therapies for some severe disorders, and also with the development of community mental health centers to coordinate local care. Mental illness, the revolving door, and homelessness. Admission rates have increased. A term that I would like you to become familiar with is the revolving door. So once a patient responds to therapy, the patient no longer qualifies for expensive hospital treatment, and they are sent back out the door into communities that aren't prepared to provide adequate care. I think a lot about our homeless population in regards to this, and if you live in, St. Clair County, maybe, I've noticed an increase of homeless population in the city of Belleville. I live in Smithton, and I commute regularly to Belleville to, go out to eat or shop, and it seems that the homeless population has really grown, and I always have to wonder if these people maybe would have received appropriate mental health care, perhaps that their situation wouldn't be so dire. So again, we've made great progress in terms of how we treat people with mental issues, but we still have a lot of work ahead of us. So that concludes Unit 2. So like I said, you need to review your notes from Section 1, Section 2, and then this section, and then go ahead and take the quiz that is located in this folder. Outside of that, hope you have a great week, and I'll talk to you soon.